Today's COVID update will begin in 2 minutes. Again, we will begin in 2 minutes. Good afternoon. Thank you for joining us today. From the Legislative Building here in Regina, we have Premier Scott Moe and Dr. Shahab. As well, joining us on the line is the CEO of the Saskatchewan Health Authority. Premier Moe and Dr. Shahab will have opening remarks, followed by time for questions.
Well, thank you very much, and good afternoon, everyone. Thank you for joining us here today. Thanks. I would like to begin by thanking the great work of our frontline healthcare workers in every part of the province of Saskatchewan. We continue to be a leader in Canada when it comes to our vaccine delivery. We've now administered in this province more than 108,000 shots. That's the second highest rate per capita of any province, only behind the province of Prince Edward Island. 50% of Saskatchewan residents over the age of 80 have now received their first shot. The pace of vaccine delivery in Saskatchewan is only going to increase in the next number of days, in the next couple of weeks. Last Thursday, we had a successful launch of our online and our phone-in booking system, and we've now expanded the age range so that everyone in the Phase 1 age group can now book their own appointment. That's everyone 70 years and older, and everyone in the far north 50 years and older. And over 58,000 Saskatchewan residents have already booked an appointment to get their shot at about 100 clinics in communities right across the province. Over the weekend, we also opened up the drive-through clinic in Regina. And I know there were some long lineups yesterday morning, and that is good in the way that it represents that there's tremendous interest in Saskatchewan residents in getting vaccinated, and that, as I say, is very, very positive news. The Regina drive-through has been operating at full capacity Our healthcare workers were delivering shots as quickly as they were able, and they were able to deliver yesterday over 1,700 shots through the drive-through clinic alone. Province-wide, they were over 4,000 people received their shots, received their vaccinations in Saskatchewan. And that number will increase in the days ahead as we receive more vaccines and our appointment system kicks into high gear. In fact, by this Friday, we expect to do over 8,000 shots throughout the province. And that's based on just the number of appointments that we currently have booked. So I would say, once again, thank you to everyone who is involved in developing the new appointment booking system in this province. I would say thank you to everyone involved in setting up the dozens of vaccine clinics in communities right across Saskatchewan. And I would say thanks to all our frontline healthcare workers who are now delivering literally thousands of shots each and every day. And last but certainly not least, I would say thank you to everyone in Saskatchewan who are doing your part by making your appointment, taking your shot, getting vaccinated to keep yourself, your family, and your community safe. And I would also say thanks to everyone who is waiting patiently for your turn. We're going to open up appointments to more age groups just as quickly as we are able to receive the vaccines. So everyone will have the chance to book your appointment and get your shot over the course of the next few weeks or a couple of months. It's the most important thing that you will be able to do to protect yourself, protect others, and to get all of our lives back to normal here in the province. So when it's your turn, as I always say, make your appointment, get vaccinated. Just a couple of hours ago, the federal officials have informed our Saskatchewan officials that the Moderna shipment to Canada that is scheduled for next week is going to be cut by about 70%. And Moderna says it will deliver the remaining 70% of those doses during the following week. This will result in a one-week delay to Saskatchewan of about 23,000 doses. This is problematic for us in our delivery of these vaccines, since our appointment system is built on the very delivery schedule that we receive from the federal government. So scheduling appointments at over 100 of our clinics throughout the province is, as you know, a very complex task. And as I previously stated, our health officials, most certainly in the last number of days, have been up to the task of ensuring that appointment scheduling system runs smoothly and runs without hiccups. But they do depend on a very steady and reliable delivery of those very vaccines from the federal government in order for it to all work out and to people ultimately be able to receive their vaccination. So our vaccine delivery team is, as we speak, working through the impact of what this delay means, and they'll make every effort to keep the changes to existing appointments to a very minimum. But there will be some appointments that will likely need to be postponed a few days as a result of this delay in Moderna shipments. While province-wide case numbers and hospitalization numbers are much lower than they were just a couple of months ago, we are seeing an increase in the number of cases, and in particular the number of variant cases right here in our capital city of Regina. As a result, on the recommendation of Dr. Shahab and his team, all of the current public health orders, which were set to expire on March the 19th, have been extended out until April the 5th. And in addition to this, as you know, across the province, places of worship are being allowed to expand their attendance to 150 people or 30% capacity, whichever is less, and that would begin this weekend. And this will still go ahead in many areas of the province. But we're not able to move ahead with this in Regina and the immediate area, and that is due to the higher cases and in particular the variant cases and the concentrations they are present here in the capital city. In Regina and area, places of worship will remain at the current capacity level, which is 30. As we continue in this province to receive larger numbers of vaccines, this does provide us more flexibility to focus our vaccination efforts on what would be hotspots in the province. So right now, as we said, due to the higher numbers of cases in Regina, as well as the higher number of variants present in Regina, one of those hotspots is Regina. So while we're continuing to vaccinate people in every part of this province, and we are doing so as we speak, we will be directing additional doses to Regina in the days ahead. And of course, we're reminding Regina residents to stay particularly vigilant. Those who are over the age of 50, they should consider not increasing their household bubbles. They should limit their travel, to limit their travel and shopping to essential trips only. And if you have any symptoms at all, you most certainly should remain at home. You should get tested also if you have symptoms or have been exposed to someone who may have symptoms. You should always continue practicing your physical distancing, your frequent hand washing, wearing a mask when you're in a public area. And I should also mention that as of this morning, the federal government updated their guidance on the AstraZeneca vaccine by removing the age restriction that was in place for that particular vaccine. Our Saskatchewan health officials are now reviewing how this will affect Saskatchewan's deployment of future batches of the AstraZeneca vaccine. But for now, we're going to continue using the current batch of 15,500 vaccines at the drive-through clinic right here in Regina. And that Regina drive-through clinic is currently open to anyone ages 60 to 64 on a first-come, first-served basis. So I would encourage anyone in Regina or the surrounding area who is in that age group to take the time to go to Evraz Place and receive your first shot. As the first day of spring approaches, and for the next number of weeks, we are now in a period of what I would say is very cautious optimism. And I would say there needs to be emphasis on both of those words, cautious and as well optimism. We need to be very cautious. We need to keep following all of the public health orders that Dr. Shahab has provided us with, all of the guidelines, to not only protect yourself, but to protect your family and those in your community. This is still a very dangerous and deadly disease, and most of us do not have immunity to this disease. But there's also reason for us to have optimism. As each and every day passes, thousands of more Saskatchewan residents are being vaccinated, 4,000 yesterday. And that makes each of us just a little bit safer. It's still going to take many weeks until we achieve a level of immunity that will allow things to get back to normal in this province. But each and every day, we are closer than we were the day previous. So keep being careful. Keep following all of the public health orders and guidelines that are in place. And most importantly, when it's your turn, make your appointment and take your shot. Get vaccinated. It is our path back to normal. Dr. Shahab?
Thank you, Premier. So I'll just go over a few of the data elements and then some key points around the variants of concern in Regina. So as the Premier said, we just crossed our one-year declaration of the pandemic, and we are at a key turn in the road. So on the one hand, vaccinations, like the Premier mentioned, are coming along really well. Vaccines are going into arms as quickly as they come, and additional vaccines are pivoting to Regina to increase population-level immunity even more quickly. But it is going to take 4 to 6 weeks for the bulk of 50 plus to get vaccinated, the most vulnerable, and then by end May, early June, hopefully everyone 18 and older would have stepped forward and gotten the first dose, and then it takes 2 or 3 weeks to get some immunity from the first dose. So hopefully by mid-June, the entire adult population of Saskatchewan will have good immunity from the first dose, and well before that second doses would have started. But again, it is important to make sure that we get the vaccine as soon as we become eligible through either booking an appointment or as drive-through or walk-in clinics become available. While this is happening, of course, we're keeping a close eye on overall case numbers, and there we can see that throughout Saskatchewan, our case numbers are still trending down. Our average case numbers for 100,000 are 11.3. Active case rate is 112. Testing rates are good, and our test positivity is 5.6. But within that now, we've seen obviously something that we knew ultimately we would get to see. Many other parts of Canada had seen that. Many other countries had seen that for many weeks and months. But now in Regina, we are seeing what we expected to see. But obviously when it comes, it is always concerning. And when you actually see it, it's also surprising. So what we're seeing in Regina is the opposite of the rest of the province. Regina case numbers are going up 100,000. They're now at 21, very concerning. So they've gone up from, the low teens to 21. Active case rate is high, test positive is 9.1. So the trend in Regina is the opposite of the rest of Saskatchewan. And, the bulk of new cases in Regina are variants of concern. So the S&P assay screen is picking up mostly in Regina that they're screening variants of concern, but occasional sporadic screens in other parts of the province, notably in the recent week in Moose Jaw, in Yorkton, and in Saskatoon, and previous to that in the PA area. So certainly small pockets, occasional variants of concern throughout the province, but mostly in Regina, where they have become the dominant strain. And now what we already know about variants is that 70% more transmissible. So everything that we were doing to keep things under control and everything that's allowing cases to continue trending downwards in the rest of the province, and even allowing some relaxation in the rest of the province, up to three households can form a bubble with great caution. Worship services can increase to 150. Unfortunately, can't happen anymore in Regina. And these things, 2 weeks, 3 weeks ago, we couldn't predict where the variants of concern would take over. Right now, they've taken over in Regina, so obviously we have to adjust the guidance. Right now, really, if you want to meet someone outside your household, outdoors is best. And 50 and over, meet someone outdoors safely. Not the time to meet anyone from outside your household indoors. In my view, it's important that you shield yourself till at least 3 weeks after your first vaccine dose. And then, we already saw in December, when we didn't have variants of concern, but our overall case numbers provincially were trending up, that voluntary measures that the majority of us took, which include, for example, if you're going shopping, try to go one person from a household, plan ahead, go when it's less crowded. If, by all means, support local businesses, and this is especially important for Regina right now, but if there's curbside pickup and you know what you want, use that. If you have to go into a store, go for less amount of time. Pick what you want, wear your best mask, reusable mask that you should wash often, 3-layer, or your best disposable mask, make sure it fits tightly. Maintain your physical distance. All these measures are going to be critical over the next week or two to start Regina cases, turning down. And again, same for restaurants. If you do choose to go to restaurants, maybe order more takeout and then going in-person dining. Same for gyms. Be extra cautious about when you're going, how you're behaving there. Be aware of people around you so that you minimize any risk of transmission in those settings. Those settings haven't seen an increase in transmission with all the reopened guidelines in place, but with variants of concern, because they're more transmissible, we just need to be extra cautious, even with the guidelines in place. And then, of course, a lot of the transmission has been in workplaces, and again, it's no one's fault, but when you're at work, at a cubicle or a workstation, usually there's enough physical distancing. All workplaces have or should have updated COVID protocols that we need to review and tighten even more. But it is really, unfortunately, in between work, at break times, carpooling, maybe socializing after work, that transmission is happening. So really, I think we need to look at all the things we do when we're out and about, but also that when we're at work, and just tighten up those protocols throughout the province, but especially in Regina, and hopefully that will turn things around. Obviously, if case numbers keep rising, then further restrictions may be considered. But again, what we have seen throughout the pandemic, March and then in the fall, were that if all of us just think about what we're doing, how many close contacts do we have, how can we minimize any opportunity for transmission, that does make a difference. And finally, I think I'll just say that this is the time in Regina that if you're symptomatic, obviously don't go to school or work. Other household members should stay home till your test results come. Usually they're coming very quickly now, in a day or two. And then, if they're positive, everyone else is at home, because variants are transmitting very quickly. By the time test results come and contact tracing happens, secondary transmission by other household members has already happened in other workplaces. So we just, especially in Regina, need to be extra cautious around if one person is symptomatic. Maybe everyone should just hold on till the person who's symptomatic gets tested and test results come, and then public health can give further advice. So hopefully over the next week or so, we really need to see some of these trends coming down and monitor very closely what further measures may or may not be required. Thank you.
Thank you, Premier Moe and Dr. Shahab. We'll take questions now, and we'll start in the room.
Just a quick clarification. Are the March 19th orders for Regina in effect, like the bubble, or is that just a recommendation to not meet more people?
So, we had very strict conditions in place since 14 December, where there were only a few exceptions if you lived alone or if you could attach yourself to one household. I think if you're a younger family and you want to connect with another family, that is likely okay as long as this is your bubble. You're converting a 2-person household to maybe a 5-person household if two families connect. I think we need to be careful, not just in Regina, but everywhere, that 2 or 3 households connecting to provide support or some social relief. It doesn't mean that you meet random 2 or 3 households, in an ongoing fashion. And I think we need to recognize that, it's no one's fault, but with the variants of concern, there's a high risk that, if you are 50 and older, have other underlying risk factors, you may start connecting with a family that may be asymptomatic, but that may be your source of exposure. You may be shielding yourself really well, but we've seen at workplaces that we underestimate the risk from people we know and love, whether it's family, it's friends, whether it's colleagues, where we'll sit closer at lunchtime, maybe socialize afterwards. So a lot of that plays in transmission, and unfortunately with B117, I think it's a surprise for all of us. Restaurants where previously maybe 3 out of 10 staff would get exposed and become symptomatic, it's 10 out of 10. At a daycare where you maybe have 3 out of 20 children exposed, it's maybe 10 out of 20. So the fact that B117 is more transmissible is becoming very evident. So all of us need to be a bit more cautious, especially in Regina, and especially if you're 50 and older. And then place of worship, obviously, I think it would be fairly high risk, even with really good guidelines for Regina to go to 150. I think it's something that it's just something that I think it's important to just maintain the status quo for the time being, up to 30 people.
Having said that, with the variants being more transmissible, why isn't there more being done in Regina specifically? You said workplaces are places of outbreaks. You could have a work from home order. We have hundreds of kids right now isolating in schools. Parents are going to wonder, why schools aren't going online for temporary time. Can you both explain why we're just doing the status quo for Regina for right now, given what we know about the variants?
So schools have seen, proportionate to the increase in transmission in Regina, more schools are getting a case or 2, but all the layers of protection in schools are preventing larger outbreaks. But schools, obviously with 117, have to look very carefully at all their protocols. Some of the larger high schools that are continuing in level 3 need to continue. I think for operational reasons, if a school has several cases in several classes, they may need to go online, like several classes on the entire school. So that will need to continue to happen, especially in Regina, but that can happen anywhere else, like it happened in Yorkton. I think the challenge is that all the things I mentioned about when you go out and about shopping, eating at a restaurant, at a gym, if we all reduce our social mixing by 50%, all those situations that may cause some transmission, maybe 25%, we reduce that by maybe half. And then the bulk of transmission still is household and close contact. So again, limiting number of contacts, everyone staying home. If one person is symptomatic, getting tested, that can reduce further transmission, maybe not within a household, but then to other workplaces and schools from the household, because everyone stays put till test results come. And then workplaces, I think, are very challenging, because I think we've always said, if you can work from home, continue to work from home. And if people were able to work from home, but sometimes it is important to be at your workplace for other reasons. But if you can go back to working from home because your work allows you to do that, that's certainly important for Regina right now. But many essential businesses, you have to be at the workplace, and that was true right from the beginning of the pandemic, that people have to be at retail locations, at gas stations, utilities, all those settings. But again, that's where, making sure that everyone understands the COVID protocols there, which again are pretty straightforward: physical distancing, hand hygiene, staying home if fail. But then the transmission happens in those in-between times, break, after work, there's a bit of a, social aspect, and then just being extra careful about that. I think all those elements, there's not one thing that you can say this will stop transmission. All those elements will have an impact, and if we can start bending the curve down through all those things, I think that's probably the best thing to do right now. Obviously, if cases keep escalating, the health system starts coming under pressure, then further restrictions could be considered. But I think we do need to give these measures a week and see how it goes.
Follow-up, Adam?
For the Premier, did you consider anything else for Regina seeing these numbers? And was it a mistake last week to say bubbles could expand? The Mayor of Regina said that she saw people not social distancing, gatherings in parks this weekend, so obviously people felt more comfortable to get together.
Well, I would first and foremost say, we made a decision, over the course of the last number of weeks with respect to expanding the household bubbles and with respect to across the province, looking at moving with our worship services. And we made those decisions in a large part due to the fact that we have faith in the people of the province that they're going to make the decision that is best suited to their, individual and unique circumstances. Also understanding that what we're seeing across Saskatchewan is somewhat variable in the decreases that we are seeing from the public health measures that are in place. And so, I would stand by that statement. We continue to have faith in the people of this province in doing exactly what is right for their specific circumstances. Understanding that some in this province are vaccinated, some are not. So most certainly, we continue to have faith in all Saskatchewan people. That being said, through and on Dr. Shahab's advice with respect to going to larger worship services in the city of Regina, given our numbers are starting to creep up here, most certainly the concentration of our variants are much higher in Regina. That Dr. Shahab said we just simply shouldn't go to that at this point in time. And we are asking people, as I believe the mayor did this afternoon, that if you are, older than 50, and you understanding that you, if you're older than 60 in Regina, you're going to receive your vaccine, if not right away, and we'd encourage you to go to the drive-in clinic right away. You will have the ability to receive your vaccine over the course of the next couple of weeks, and I'll maybe quote some numbers on vaccine arrivals here, which I think are important as well. But you will have that opportunity, and that may change the decisions that you will make in the days and the weeks ahead. On vaccine accessibility, specific to Regina, and a credit to the Ministry of Health and the Saskatchewan Health Authority and Dr. Shahab's office on ensuring that, to the level of vaccines that we have available, we're getting those into the places in the province where they ultimately need to be. We've delivered 108,000 vaccines thus far. That includes over 4,000 vaccines yesterday. Over 2,000 of those 4,000 were delivered into Regina yesterday. If we look out until the end of the month, or until the end of phase 1, out till April the 5th, we're going to be able to receive and likely deliver about another additional 147,000 vaccines. So more in the next 2.5 weeks than we have done this far, and we're poised to increase that to 6,000 to 8,000 vaccines a day by the end of the week. By diverting the AstraZeneca vaccines into Regina, yes, due to the increased caseload, yes, due to the high concentration of variants. I looked on Stats Canada, and we have about 75,000 people in Regina that are 60 years old and older. We will have, by April the 5th, about 65,000 vaccines available to those folks 60 years older in Regina. So about an 86% opportunity for folks 60 and over to have access. Virtually all of them will have access to a vaccine by the first week in April, and that's a very positive statistics given if you look a few months ago, the tools we had to control the spread of COVID-19 were public health measures. Today, we also have public health measures, and it's important for all of us, in particular in Regina, to be to adhere to those measures very closely over the course of the next number of weeks. But we also have access to vaccines. And with 86% of people over 60 being able to have access to that vaccine here in Regina by April the 5th, we have additional tools that up until this point in time, we just simply haven't had.
Just one thing I just want to say about even more Christmas, we saw that a lot of people were outdoors, meeting and greeting outdoors. Outdoors is much safer than indoors. As long as you maintain that 2-meter distance with people not in your household, you don't really have to wear a mask if you're outdoors and can maintain the system. So seeing hundreds of people out walking, cycling over the weekends in Regina is great. I think it's great to spend time outdoors. It's great for your own mental and social well-being and physical well-being. And if you see friends and family outdoors and maintain that 2-meter distance, I think we need to do more of that, but be really careful about socializing indoors, because that's where transmission happens. And spring is on the way, summer is coming, and vaccination, spending more time outdoors, all those things are important to maintain a sense of well-being, because COVID fatigue is real as well. But also, keep an eye on transmission, especially in Regina, but everywhere in the province, as our vaccinated numbers go up.
We'll take our next question on the line. Operator?
We have Stephanie Taylor with the Canadian Press.
Mr. Premier, you've said in the past that lockdowns, whether total or partial, work temporarily. And it seems that we're in a position, at least in Regina, that we're waiting until enough people get vaccinated until there's more immunity in the community. So is this not a good time to bring in tougher public health measures instead of just asking residents to follow them when your government has the power to really reduce the amount of interaction and break the chains of transmission?
We do have significant measures, not only in Regina, but in across the province of Saskatchewan, and we're not moving forward with relaxing those measures, in particular when it comes to large gatherings in our worship services in Regina. So there's significant measures in place, including in Regina, which will be a little more significant than other areas of the province for the short term, until we can ensure we have, it's really a week by week kind of look, as Dr. Shahab had indicated, as to where we go. If there needs to be more significant measures looked at in the future, for example, looking at some of our senior years in high schools going to a level 4, and I understand a few schools are looking at that now. I know Dr. Shahab and his office are in constant communication with our larger school boards here in the province on potentially that being an option. Always understanding that is to the greatest degree possible, we want to keep our students in their classroom, in their learning environment. But we do have significant measures in place. There may be some additional ones that would be considered on a weekly basis. We also have much broader access to vaccines than we have ever had in this province, and we have and the Saskatchewan Health Authority, the Ministry of Health, and Dr. Shahab have made the choice to divert a number of those vaccines into Regina. The AstraZeneca vaccines, 15,500 of them are being made available as we speak at the drive-through clinic over at Evraz. And we would encourage anyone 60 to 64 years old to consider getting a vaccine and going over to that facility to receive their vaccine. This will ultimately put us in a position where we are in Regina able to provide 65,000 vaccines to folks that are 60 years and over in the community of Regina, and that is in response to, yes, the cases starting to climb, still much lower than they were a few months ago, but they are starting to climb in the high concentration of variants that we have here. So it isn't just about measures, it's about the measures that we have. It's about ensuring and encouraging people to follow the measures that are in place that have proven to be effective, but also having one of the robust and one of the most effective vaccination plans in the nation, which I believe Saskatchewan does have, and nowhere is that on better display than right here in the city of Regina today.
Follow-up, Steph?
Mr. Premier, if the existing public health rules are working, why is it Regina cases seem to be trending towards a surge or a big uptick, and that we have almost, more than 300 variants of concerns, both confirmed and presumed, in the city if the existing public health measures are working?
Well, I would say if you go back to the middle of December, when we put these existing public health measures in place, the active cases in Regina were about 1,200. We're now down to between 400 and 500, I believe just over 500 today with respect to the active cases that are there, and have many more vaccinations already in people's arms in the city of Regina, and 2,000 more as of yesterday. Likely at least another 2,000 going into arms as we speak today and every day into the foreseeable future. So the public health measures have proven to be effective. What we are asking here today is for, and we have faith in the fact that all the Saskatchewan people will continue to follow the public health measures at what is quite a critical time in our response to COVID, and we most certainly have faith for those in Regina that will be able to make the decision that best pertains to their individual and unique case. We have people in Regina that will be vaccinated. We have, as Dr. Shahab said, younger families that quite frankly may not have seen other family members for a number of months now, and we understand that this has been a long haul, and that long haul continues for the next number of weeks. But we do have faith in the fact that not only all Saskatchewan people, but Regina folks and Regina families as well will make the most responsible decision with respect to their individual and their unique case, understanding that we do have a tool available to us today that we just simply didn't have 3 months ago, and that is much larger access to vaccines. Almost about 147,000 will be receiving between now and April the 5th. We've only got administered about 108,000 since the beginning of this vaccination campaign. So that is a significant tool that we haven't had access to before. We're compiling that and adding that to the public health measures that are in place, asking people to pay particular attention to those public health measures over the course of the next number of weeks. That goes for everyone across the province, but in particular, we need to be very careful in Regina due to the higher level of the variants of concern that are present here now.
Just one thing I want to add was that we're updating information on our website called Know Your Risk. And we all know that, but I think it's worth looking at that link, and we'll be refreshing that with further information. And I think it is important for us to understand, because of course, lockdown like in March 2020, that's the big hammer that has an impact, but at considerable cost. And if you do a local lockdown, that has some unintended consequences as well. But certainly if case numbers continue to trend upward to concerning level, that is obviously always the last option. But if you look at the Know Your Risk link, and I would encourage everyone to visit that, and we'll keep that updated. We'll keep updating that. Just like I was saying before, outdoors, with lots of people outdoors, but maintaining the physical distance, virtually zero risk. Unless you cough in someone's face or hand things back and forth, it's zero risk. In a well-run business like retail, where you're keeping your physical distance, wearing your best mask, doing things very systematically, low risk. Restaurant running properly, it's a moderate risk if you're at a table with people not in your household, and you should choose to go if you are willing to accept that risk. Maybe if you're older, have comorbidities, maybe takeout is better. And maybe all of us, supporting local businesses, but doing more takeout, more curbside pickup is especially important for Regina right now. And I think that way, you don't have the hammer of the lockdown, but reduce transmission opportunities. And that's especially true with B117. Like I said, we all had read that it's more transmissible, but when you see it, you do notice why it's said to be more transmissible, that instead of 3 out of 10, you get 7 out of 10 impacted when that opportunity is created. And that opportunity is always, for the most part, indoors, close proximity, no mask, whether it's a bar, whether it's a place of worship, whether it's someone's house, whether it's a workplace. It's always the same story. Closer together than 2 meters, poor ventilation, crowded, no mask, talking, singing, and that's what really, so that's where the transmission risk is high. There's a gradient, and I think the more we can continue to work and be out and about in a safe manner, but reduce those transmission events, I think the more effective we can be collectively in turning case numbers down. And lockdown ultimately is always there as a last resort, but it comes at significant cost. It has to continue for 4 weeks or more, and it has its own unintended consequences.
I would just say as well, we have a number of regional measures that are now in place in Regina versus other places of Saskatchewan, significant measures across the province. And this is what we all need to adhere to, and we're asking Saskatchewan people to adhere to these measures. In particular, be vigilant with these measures in Regina, and that will help us through the short term. The medium to long-term way for us back to more normal, and the medium to long-term way for us to actually manage COVID-19, whether it's the variant or the original strain, or is to when it's your turn, make your appointment and get vaccinated. Ultimately, access to vaccines and the broad-based uptake of those vaccines by the general community is ultimately going to be the way that we control this virus in the medium to long term. So we're asking people to be, in particular, diligent right now, and doing everything that we can to provide as many vaccines as possible to the people of Saskatchewan, and prioritizing those through the phases, as well as to areas of the province that require them sooner rather than later. And right now, that's Regina.
We'll take another question on the line.
We have Phil Tank with the Star Phoenix.
Yeah, I would like clarification on what's going to happen province-wide with the restrictions that are in place. They're set to expire on Friday. We know that the worship service guidelines are going to be, not loosened in Regina. But what happens in the rest of the province with those guidelines? Have you decided yet? Do you know how long they're going to last? Yeah, the Premier seemed to suggest that they're going to last till April 5th, like right after Easter. Can you be really clear about how long those guidelines are going to be in place?
You want me to go ahead?
Yeah, I think so. Again, one thing, of course, is that going from 32 back to 150. 150 worked well October, November, early part of the fall, and then when our case numbers went up, we went down to 30. So overall, our case numbers outside of Regina are coming down to an extent that cautiously we can, allow, worship services back to 30% of 150, whichever is higher. But people still need to follow the guidance. And like I said, it doesn't matter what the setting is, a home, place of worship, bar, workplace. If people are closer than 2 meters between households, not wearing a mask, talking, singing, transmission happens. And so I think that's what is the important thing. Plus, if you are 50 and over, weeks away from getting vaccinated, maybe it's important to continue to attend virtually till you're vaccinated, protected, and then assess your risk and decide accordingly. And then the other restrictions that are in place, I think all of those will need to be reviewed mid-April and then mid-May as more of the population gets vaccinated. Ultimately, the hope really is that by April, May, we can go back to where we were August, September. By summer, we can have less restrictions than we had last summer. That's the hope. Obviously, the variants of concern are adding some complications, and we need to just respond to that. Right now, mostly concerned in Regina, but we'll have to watch in other parts of the province, and continue to deal with these unexpected issues as they arise. But certainly, I think we need to give the 4 to 6 weeks for 50 plus to get vaccinated, another 4 to 6 weeks for everyone 18 and older to get vaccinated. And those two events, 50 and over vaccinated, so you've got your high risk covered, and then it takes 2 or 3 weeks for some immunity, some further relaxation, but knowing that especially if variants of concern are picking up, you can still see very quick transmission in people who are unvaccinated and some in people who are vaccinated and not fully protected. But then once you come into end May, early June, 18 and over have been vaccinated, I think there's more confidence 2 or 3 weeks out. But like the Premier said, we do need people to step forward. Like in some long-term care facilities, staff vaccination rates are lower than 90%. They may be 60, 70%. Resident vaccination rates are 90% or higher, so that's great. But we really need, as your age group opens up, we really need to see a high vaccine uptake, 85% or higher ideally for high-risk groups, but overall at a population level, 1 dose higher than 75-80% uptake by end of May, June, to really have the confidence to open things up gradually and safely.
I would just make a couple of comments here to be very, very clear, Phil, and I understand there are a few of my colleagues maybe that have not been able to quite understand just how clear we have been throughout this pandemic. But we are working on a week-by-week basis here, which is the extension of the public health measures across the province, and in the Regina's case, even a community-by-community basis. But just to be entirely clear so that everyone understands, public health measures across this province are extended until April the 5th. Worship services will be expanded across the province to a 30% capacity or a maximum of 150 people if the facility is large enough for that. Save for Regina and the surrounding area, where we are not able to expand the worship services, they're going to remain at a cap of 30 people. Households across the province can be expanded to 3 households, a total of 10 people. What we are recommending, in particularly a strong recommendation to the people in Regina, is you should very much assess your individual situation, understanding your age, your risk to severe outcomes with COVID, understanding whether or not you have been vaccinated or not over the course of the past number of weeks. And we have people in our communities that have been vaccinated and similar age right now that have not been vaccinated. Also, you should understand, and again in particular in the community of Regina, that if you're over 60, you're going to have access to that vaccine today or over the course of the next number of days, and for sure over the course of the next few weeks. All of that could impact your decision on whether or not you're going to expand your household bubble or not expand that household bubble. This is where we have faith in all of the people in Saskatchewan, and in particularly we have faith in the families in Regina. They will make the decision that is best suited to ensuring the safety of them, their family, and ultimately those that are close to them. So that, in a very clear and concise fashion, those are the changes that are made between now and April the 5th.
Do you have a follow-up, Phil?
Yes. You issued a warning today against for people to avoid unnecessary travel to and from Saskatchewan. I'm just wondering whether you considered a travel ban like you did with the northern half of Saskatchewan in April, because province-wide active cases at that time were like a fraction of what the cases are, or active cases are in Regina right now. And of course we have, the variants are still kind of an unknown there. So I guess I'm just wondering why it's an advice instead of a ban.
I'd say 2 things have changed since then. 1, we understand the virus much better than we did last spring, and 2, we have access at an increasing rate, day by day, to vaccines here in a very localized area in Regina, and I commend the general rollout of the vaccination plan by the Saskatchewan Health Authority across the province. In particularly, commend them for the efforts they're making to ensure that we have the maximum number of vaccines available right here in Regina. And so, for instance, in addition to the increased public health measures that we discussed here in Regina today, I mentioned earlier, there's about 75,000 people that are 60 years and older in the city of Regina. We're going to have, by the first week of April, about 65,000 vaccines that would be available to those folks. So the Saskatchewan Health Authority, the Ministry of Health, they continue to ensure that in addition to the public health measures that Dr. Shahab has put forward, they have a very robust, very efficient, and I would say the strongest vaccination plan in the nation. And if we look ahead to April the 5th, when we will have received about 256,000 vaccines here in the province, we are going to have access to those vaccines in the far north by everyone that is 50 years of age and over. In Regina, we're going to have access to those vaccines by everyone that is 60 years of age and over, and then in the rest of the province, everyone 70 years and over. So very robust plan, focused on age-based priority, those highest at risk, but also very much focused on ensuring that we're able to turn those vaccines around, make them available to Saskatchewan people in as quick a fashion as possible. As I said, over 4,000 available, actually offered to people, administered to people yesterday, and will be up to 8,000 by Friday. So, a real credit to all the frontline Saskatchewan Health Authority staff, all of those that are involved in this vaccination effort, and a thanks to all of those folks in the province that continue to abide, and I know it's been a long time, but continue to abide by and make the best decisions with respect to their situation and following the public health orders that have been put in place by Dr. Shahab. We're getting there. We just need a few more weeks.
Regarding travel restrictions, I just want to confirm that, if you look at the news release, Act to Reduce COVID-19 Transmission in Regina, some of the restrictions on places of worship and other measures address many of the bedroom communities around Regina, so Belle Plaine, Pence, Grand Coulee, Lumsden Beach, Regina Beach, Craven, Lumsden, Pilot Butte, Edenville, White City, Belgoni, Rono, Devon, Grain, Reston. So, it does impact a larger geographic area, and the reason for that is that obviously people may commute to and from work daily to Regina, so the recommendations and continuation of the current restrictions encompass more than the city of Regina. Beyond that, we know that in the Northwest, essential travel for groceries, for medical care out of the Northwest was allowed and, in fact, recommended because you don't want to delay ongoing medical care. And many people come to Regina from the whole south of the province who must and should come to Regina for their ongoing medical care. Health system protocols are really strong in terms of preventing, or minimizing any risk to patients seeking care. So we don't want to see any of that getting reduced. But beyond that, I think this is not the time to travel out of Regina or come into Regina for things that are not essential, because we don't want, obviously, we want to minimize the export of variants to other communities unnecessarily and minimize, people coming into Regina getting exposed to variants of concern as much as we can. Like, obviously, essential travel and work needs to continue. But again, if we can slow down travel, and with the Easter break, again, I know people are getting tired of hearing this, that stay close to home over school break or Easter break. Stick to your household. But, hopefully this is the last time we have to say this, that, again, Easter break is coming, stay closer to home, enjoy the outdoors closer to home. And I think those things, again, remain important for the province and especially important for Regina right now.
We'll take our next question in the room. Mark?
Regina's been seeing a growth of cases for at least a month now. With the current restrictions that are in place, what do we think is going to be different over the next week that could change that? And are we going to need stronger measures, and why wait a week then?
Yeah, I think, we have had discussions on this within government and with medical officers of health. So again, I think there's a concern both ways. Like, I think if you can turn things around without going into a wide lockdown, that's important. And we have to remember a lot of the transmission is happening in workplaces that are otherwise essential, that remained open even in March. So I think we need to fundamentally understand the situations where all of us could be, at work, or even if there was a lockdown. There's many situations where people are going to work, are doing essential grocery shopping, that we need to pay special attention to that right now. And our experience has been that throughout Saskatchewan, if most of us reduce our, activities by 50%, which we all need to do right now in Regina, people who can work from home must continue to work from home, or again start working from home. All those things, I think there's a real possibility we can, turn this around. But of course, if we can't, then obviously some of those lockdown measures are very blunt instruments. They don't always hit all the sectors that may be causing the bulk of the transmission, but that may have to be considered. But again, even they take time to have an impact, and slow down measures like we described can have a similar impact, but it needs all of us to comply, and I think that will be the key thing here.
And that's what we're asking, not only the people of Regina to do, but the people across the province. In the case of household, the relaxing of our household bubbles is to use your judgment with respect to your individual situation. The measures that have been put in place in Regina have worked. We were at about 1,200 active cases in the city of Regina. If you look back to when these measures came in place in December, we got down to in the range of about 350. And over the last month, we've bumped up 350 to 500, back down into the 400 range, and now we're crept up just over just over 500. So the measures do have an impact. And what we are asking, and have been asking this week and asking today, is for those in particular in the city of Regina to be especially diligent with the measures that we have. They do work, but as Dr. Shahab says, we all need to follow them and follow them very, very diligently. In addition to that, understanding the risk of severe outcome with COVID, being hospitalization or ultimately a fatality, 88% of those that of the fatalities that we have are folks over 60. That is why the Saskatchewan Health Authority, the Ministry of Health, have prioritized our vaccination program and our vaccines, quite frankly, into the city of Regina over the course of the next number of weeks, to the point that we will essentially offer the vast majority of people that are over 60 in the city of Regina will have access to a vaccine should they choose to do that. And I would ask them that it is your turn now, if you're over 60 in Regina, to go to the 60 to 64, go to the vaccination clinic, the drive-through clinic, and receive your vaccine. If you're 70 years or older, I hope, if you haven't already, you've made your appointment and ultimately will be on your way shortly to receive your vaccine. With the extension of the AstraZeneca vaccine not being limited to those under the age of 65, in the next day or so we'll probably likely hear the Saskatchewan Health Authority start to look at how they can address, if there's vaccines available, that 65 to 69 age group. And Scott, I don't know if you're on the line, if you have anything to add to that. That was an announcement, obviously, that was just made this morning. But I know your folks have been hard at work as to, how we manage that change in approvals on the age-based criteria for the AstraZeneca vaccine, given that we have the drive-through clinic operating here in Regina.
So there hasn't been Premier, a firm decision on it. We're going to go through this, as you've already pointed out, the 60 to 64 group, and we did get an uptick, as you know, and got busier today when we did expand that age group. So we're going to focus on that age group over the next couple of days to see where the vaccine levels go with respect to the drive-through, because they are, as you know, seeing lots of patients. And then a decision would be made to open it up to a broader age group later in the week if, in fact, we're not seeing the type of uptake we want to at the drive-through. But we do have time to make that pivot, and we will later in the week.
I would just add to that two thank yous. One, to the folks that are working in all the vaccination clinics, but in particular the drive-through vaccination clinic here in Regina, and two, to the people that are making their appointments, going in and getting their vaccines, and to those folks 60 to 64 here in Regina that are waiting in line, likely as we speak, some of them, to get their vaccine in that drive-through facility. We're trying to make these vaccines as accessible as we possibly can, as convenient as convenient as it can be, so that people will choose to get vaccinated. Ultimately, as I say, through the medium and longer term, this is our path through COVID-19. This is what we've been waiting for, managing, making sacrifices for over a year now, and we're almost there.
Follow-up, Mark?
Over the past 2 weeks, Regina has seen a drastic increase in cases in schools. 2 schools in the Central East region have moved online due to variant cases in those schools. How many active cases do we have in schools right now, and how much of that is variant spread? Are we seeing variant spreading in schools right now?
So I can just quote for some data on schools. In schools, first of all, I think, and again, the Premier recognized many people, essential staff who've been working throughout, healthcare staff, but schools have done a tremendous job. In August we were very nervous about school starting, but throughout, and even when we had a fall wave, schools kept going and did a tremendous job. Schools reflect transmission in the community, but from that perspective, right now we've had 400 schools who've had at least one case, with a total of 89 high schools impacted and 369 elementary, usually 1 or 2 cases. And if you look at the bulk of those have been resolved, and right now there are maybe 68 schools with a case and 36 schools with maybe more than one case. So again, things, for the most part, you have a child who may have gotten exposed in a household, feels unwell, gets tested, and if that child was in school 2 days before feeling symptomatic, it's considered a case in school. Contact tracing is done, and if there were any close contacts, they are asked to stay home. Usually you see no further transmission. Obviously, with variants of concern, we're watching that closely. So far, we haven't had large outbreaks in schools, and that speaks to all the protocols in place, mask use, staying home if you're sick, other measures in place, but that's something we'll have to watch closely. Obviously, some cases, if you have larger cases in the community, like in Regina, and you have 2 or 3 classes that get impacted because there's more cases in the community. Sometimes the entire class needs to go on to remote learning for a couple of weeks, or if it's impacting a large number of classrooms and teachers, the entire school may opt to go remote learning for a couple of weeks. That has always happened in the past. It happened in Yorkton also, like I think in September, October, when there was an outbreak linked to a gym. So those things will continue to happen. We'll continue to monitor. But obviously, in the Regina area, we'll have to closely see, does the B117 transmit more easily in the school setting, and if so, are further precautions required, which could in some cases be, as the Premier said, high schools continuing at level 3, going to level 4 if required, so hybrid learning, alternate day, or level 4. And for elementary schools, generally it's lesser of an issue, but if further provisions are required, that'll be considered.
I'd just add to that, really what, in many cases, just expanding a little bit on what Dr. Shahab had indicated, we had a number of schools that had 1 case, nowhere near that number of schools that had multiple cases in their school, which means that our schools, our teachers, our educators, all of our school staff, our families, and most importantly, the students, have done a great job at preventing the spread of COVID-19 within our schools themselves. Very few outbreaks that have happened within the schools themselves, and for that, we owe a debt of gratitude. Schools in Regina in particular, but across the province, school divisions and others are in constant contact with Dr. Shahab and his team as to the operating level that they should choose or be recommended to operate at. I think we saw even most recently this past week where there's been a few tweaks to online learning or distance-based learning in and around the community of Yorkton, where they did have a few cases in the schools there as well. And so it's an ongoing conversation, and this is, one of the areas that, in particular in our senior years in the K-12 system, that may be, considered in the next number of days. I understand there's a couple of schools in Regina that have chosen to move to a level 4 online or distance-based learning as we speak. But that's an ongoing conversation between the school divisions, between Dr. Shahab. All of the metrics and resources are there for that to happen. We've been there a time or two throughout the course of the past year. It would be my hope that we'd be able to keep our students in the classroom. But if that isn't possible over the course of the next number of weeks, I would say that it would be just for that, the next number of weeks until such time we have a large number of vaccines available to the people in Regina and ultimately the people across the province over the course of the next couple of months. We're in a, I use the words cautiously optimistic in my opening comments. I think both of those words are very, very important, and both words for us to really keep front of mind over the course of the next short while.
We'll take our final question on the line.
We have Allison Bamford with Global.
Hi there. Today, Sandra Masters had said that the city is essentially on standby for further restrictions from the province, and they're being updated every 8 hours on the variants. I'm just wondering, what is the threshold that would lead to further restrictions being relayed to Regina?
Yeah, thanks. So I'll maybe just quote a few stats from transmission risk, and this links to earlier comments about schools and other settings, and then come to this question. So, our epidemiologists actually looked at the data again, and so if you have a case or in a school 9 times out of 10 it is acquired outside the school, and then not everyone in a classroom is a close contact, but if you had 3 or 4 close contacts, transmission in a school setting is actually the lowest risk, only 11%. If you have close contacts in a workplace, and all of us should be able to say that in a workplace, there's no one who's a close contact. We kept 2 meters apart from everyone else. We wore a mask in public places, and that way you can say no one was a close contact. But if in workplaces we see that if you have a close contact, the transmission risk is around 23%. And then in social gatherings, if you have a close contact where you're not taking precautions in a home, in another setting, the transmission risk is 60%. And that's same as a household. Household or social gatherings, 2 out of 3 people get COVID, and what we're seeing with 117 is it's almost 100%. So all the measures we're saying is that where it's safer, the risk is lower. We still need to be extra cautious, but settings where maybe meeting someone who is a high risk in a house, who's not in your household, having any kind of indoor gatherings in a way that promotes transmission is high risk. And that's where the concern is. So with that in mind, obviously transmission right now, as described by medical health officers in Regina, continues to be mostly workplaces, mostly in settings where there's transmission that probably happens more likely at break times or before or after work or carpooling. So that's all the things that need to be addressed in the work setting. Everyone who can work from home must work from home. All our other activities, like we described, shopping, we need to be more systematic about that, order more takeout. So all of those measures, if you start adopting them today, we can see a downward trend in 3 or 4 days. And so that's the first thing. We do need to see a downward trend. If our case numbers continue at the current high level, 50 plus cases a day, 100 today, average of higher than 50, we'll have to see is what proportion are secondary household transmission, which is hard to avoid, what proportion are in the workplace, what are happening in specific settings like restaurants, gyms, and if we see an increase in transmission in any of those settings, that's where unfortunately then further restrictions may be required in those settings or more broadly. But again, I think in the past we've always been able to bend the curve even in the fall through all the measures we've described. It's going to be much harder with variants. They are 70% more transmissible, but I think we do need to give it our best attempt starting today, all of us who live in Regina, and see where that takes us over the next few days. But certainly higher transmission rates, we're at 21 cases per 100,000. If that keeps trending up, test positive is at 9. If that keeps trending up, all of those are indicators that will inform us about our further restrictions required, but also the settings where transmission happens. And again, like we said, it's always, gatherings, social gatherings, or during work. Transmission doesn't happen when you're in your workstation and someone is at their workstation. It happens in those in-between times where we're all human and we interact socially and transmission happens. So I think that's where we need to pay attention. And of course, going to work while you're unwell, I think special attention to that. Seek testing, stay at home. Other household members who may also be working, going to school, stay home till test results are negative.
I also talked with Mayor Masters. I have talked to her frequently, as recently as this morning, late this morning, and I just take the opportunity to thank her for her leadership, in the COVID response and the efforts that she had made. Just quickly glancing at her comments today around Regina residents being in particularly diligent when it comes to following the public health guidelines that are in place. There are other levers that can potentially be pulled in the weeks ahead, up to and including obviously a more significant lockdown of retail businesses in the community. But it is incumbent on all of us in Regina, and I thank her for her leadership in encouraging Regina residents to be very diligent with the public health measures that are currently in place and have proven to work over the course of the last number of months. Also had the opportunity to update Mary Masters on the vaccination plan as we look out over the course of the next 2 to 3 weeks here in Regina, and how the vast majority of people in Regina age 60 and over will have the opportunity to have access to a vaccine over this period of time. 65,000 vaccines will be delivered into Regina by about April the 5th, by the first week of April. Those are positives in our addressing not only the increasing rate of COVID over the course of the last number of days in Regina, but addressing and getting ahead of the number of variants, the concentration of variants that we have in Regina.
Follow up, Allison?
Yeah, so the vaccine clinic here in Regina, I've spoke with several people who traveled from out of town, like Estevan outside of Moose Jaw, to come get their vaccines. I know we're now recommending not recommending unnecessary travel to and from Regina, but you're now touting all of these more doses coming to the Regina area. Is that of concern that people out of the city are traveling to get their vaccines?
My understanding is that the vast majority of, and I understand there are some people from outside of the surrounding area of Regina that will be utilizing that clinic, and it is a Saskatchewan Health Authority clinic. But my understanding is that the vast majority of people that are utilizing that clinic are from the drive-through clinic, are from the city of Regina, and are receiving their vaccine, which is a good thing given the concentration of variants that we have in this province, or in the city, pardon me, and given the fact that we are addressing those that ultimately would have the most severe outcomes should they contract COVID. So yes, there'll be a few people that do arrive at that clinic from outside of the city of Regina, but we most certainly have placed it here to address as many people from Regina and in the immediate surrounding area as possible. And as we discussed, that's due to the increasing numbers and the increasing concentration of the variants. We want to get ahead of them as to the degree that we can by providing as many vaccines as possible. We have the drive-through clinic as well as the mass immunization clinic that's by appointment. We're operating right next door over at Evraz Place in the International Trade Center. And my understanding that the uptake and utilization of both has been very strong, and for that I thank the people that are doing so. Anything to add, Doctor?
Yeah, I'll just say that, and again, Scott could comment further, but, this is, in Saskatchewan, everywhere in Canada, we are now embarking on the largest vaccination program we've ever done. So up to 1 million doses by beginning of June, and then second doses quickly in June, July, August. Obviously, the supplies come in batches and sometimes they're delayed. And obviously, the Saskatchewan Health Authority needs to make sure that as much as it can, the booked appointments have vaccine on hand, but sometimes they may need some adjustments as well and some inconvenience for people who had their appointments booked. But beyond that, any additional vaccine, offering it like the drive-through clinic. And for the most part, people in the city of Regina, for example, are accessing that. But if people come from other places and take the trouble, and it's not by appointment, as long as you're within that age range, a vaccine, as soon as it goes into an arm, in 2 or 3 weeks, it starts giving protection. And I think we need to, as citizens of Saskatchewan, challenge SHA to make them run out of vaccines as fast as they come. I think that's what I would like to see, instead of SHA having vaccines piling up. And, the vaccines are coming fast and furious. The clinics are being booked very quickly into the future with lower age ranges. But if there's any additional vaccine, making it available more broadly through these measures, like in the Saskatchewan drive-through clinic, whether it's directed to an area of high transmission like in Regina or otherwise, I think all of these methodologies will be critical to get vaccine into arms as quickly as possible.
I would, Scott, you might have something to add here as well, but I would agree with Dr. Shahab with respect to making every effort and then challenging Saskatchewan people to run well, first of all, make your appointment and get vaccinated, but let's do everything we can so that as soon as the Saskatchewan Health Authority does receive the vaccines, that we are able to utilize them as quickly as possible. The frontline Saskatchewan Health Authority staff, our vaccination teams within the Health Authority, and as we look ahead, others like pharmacists and others that will be participating in this, they're ready to deliver these vaccines as we receive them. They're ready to undertake and are already undertaking what is a Herculean effort in providing these vaccines to all Saskatchewan people that choose in a very, very short period of time, making every effort with their plan to make it convenient, to make it accessible to all of the people in the province. And for that, I commend each and every individual that is involved. But Scott, would you have anything to add to that?
So the only thing I would add, Premier, is that our teams are ready, and we will continue to be ready and expand clinics as more vaccine comes available. And our ability to immunize will not slow us down. It will be the supply of vaccine, and as long as vaccine's coming in large quantities, it will be put in people's arms quickly and in large quantities.
And for that, we say thank you.
That concludes today's update. Thank you for joining us.
Thank you.